Got it. Hi there. My name is Grace Strickland. I'm really excited to be here today and to talk about One Health Clinic and my personal involvement and my personal story with One Health Clinic. I I'm you can perfect. I wanted to give a little bit of background about myself. I've been in on and off homelessness since I was about 17 years old. I moved from Snohomish County to King County when I was about 19 to be a little bit closer to more resources and opportunities that allowed me to get out of the position that I was in. I had found a relationship, and then with that relationship, my partner at the time and I had a friend who had puppies, and I and him had a continuous conversation about possibly getting a dog, which we ended up doing, and it was one of the best decisions for the both of us, and continues to be. Our dog's name is Nugget. I had been struggling to find resources around veterinary care because we were trying to save money to get into a place. And one of the drop-in centers that I was receiving resources from, Street Youth Ministries, had directed me to a new resource called One Health Clinic. And I was told that through One Health Clinic, I was able to take my dog and receive free veterinary care, which was spectacular to hear. On top of that, they had also said that if I had any other concerns, human related, for myself, that I could bring them up after the visit. When I initially went, I wasn't entirely sure what I was going into. A lot of my personal experience, amongst a lot of other people's personal experience with healthcare, had not been the greatest. And I decided that I would do this because it meant making sure that my dog was getting the vaccinations and maybe resources that I so desperately needed for him. When I got there, the staff there were incredible. I really was amazed at the difference of care and compassion that what I was receiving just with a 30-minute visit. I was so moved by the clinic that I continued to go back. So just to kind of take a step back to let you guys visualize what the clinic looks like when you first step in.
Stop.
So to just kind of step back and give you guys kind of more of a view on what the clinic looks like when you first step in. There are some people, some students, social work students, if I'm correct, that help with intake work and help with paperwork when you first get in there. But behind those first initial intake paperwork is a beautiful team of veterinarians and veterinary students who are waiting to help you with your pet. And we've seen anything from ferrets to cats and dogs to, I believe maybe we've even seen a snake in there. They're willing and ready to do almost anything that they have supplies for. You get to kind of talk to the veterinary students about what your concerns about your vet or your pet is, and then you get to kind of let them learn a little bit about veterinary work and stuff like that, as well as uh, address all sorts of issues. The other side of it, which I don't believe we have a lot of pictures of, is we have Anina, which is a provider through Neighbor Care Health, which is there to assist with any human-related needs. That's kind of a little bit more personal, so we've got a lot more photos of our veterinary staff just shining. The other half of this is like there is so much donations, food wise, supplies wise, coat wise, that you get to walk away from, and a lot more like flea medicine for further stuff for months down the line. The difference between, I think, this clinic and any other drop-in clinic or a resource that I've gotten to be a part of is that they really care, and I feel like you're really listened. And I think a lot of those pictures that we had just moved through really plays into what I'm really trying to advocate for is more like trauma-informed care, more knowledge about where people have possibly been prior to any resource or clinic that they've been in. I really enjoy, no matter where I'm at in my life or homeless career, that I'm always able to get compassion from people like this and a clinic like this. I really so I've been on and off homeless throughout my young adult and my youth life. I'm currently nearing 30, and I've been housed for quite some time, and still do access services sometimes, but now that I've been in a more stable position of my life, I have decided that I wanted to be a little bit more involved with this clinic, and through that I started in 2021 working outreach and sitting as currently as well as a board member. In 2021, we had reopened the clinic and had not been getting as much attendance. And through my lived experience, I had knowledge that allowed us to access and access more people that may need this resource and give information that it was out there. I have as well currently served as lived experience for the board for One Health Clinic. The biggest way that I think I've helped is to help improve maybe ways that the clinic could possibly from a person that's receiving services standpoint, but also to be able to continue sharing my story to help the clinic because it's been a very pivotal part of me being able to get stable. I have said this before, but this clinic and this resource has alleviated the fear of whether I feed myself or I feed my dog. And I think that no matter where you are in life, that having companionship and unconditional love is extremely important. And having a pet really really helps that. It's helped me want to be better, not just for myself, but to be better for my dog and to make sure that we're both in a healthy, safe environment so we can be happy. Um, the the continued involvement with the clinic makes me have a purpose for the hard experience that I lived in my life. And I just think that as long as I can speak and have a voice, that I would like to share this story so it could continuously help other people and maybe make more resources like this possible.
Thanks, Grace.
Thank you.
Yeah, we are so lucky and thankful to have Grace as advisory board member for the One Health Clinic, just because the voice she brings is invaluable to what activities that we're doing and things that we can grow into. And it's been wonderful having you, Grace. My name is Vickie Ramirez, and I'm going to do the second half of this presentation. I am doing this in the stead of Jessie Kelly, who was a graduate student at the University of Washington, who did an evaluation on the One Health Clinic, the flagship One Health Clinic in Seattle at the Youth and Young Adult Shelter that Grace mentioned. This is Jessie's data. She was just not available to record at the moment. This presentation is going to be about this publication that came out very recently, and we'll just be walking through it. So just very briefly, the One Health Clinic comes from a concept called One Health, where we consider that the health of people, animals, and the environment are all interconnected, and that you can't access or affect change in one group without considering the other groups that are always adjacent. And so when we consider a One Health clinical care model, we are really looking at integrating the human and veterinary healthcare so that we can create a single healthcare plan for the family unit, for the owner and the pet. Just because we know that the health of the owner affects the health of the animal, and the health of the animal affects the health of the owner. And so if we can create a single healthcare plan that helps them both, it can put people in a better position. So as Grace talked about, really lovely, the One Health Clinic was started in 2018. It was a collaboration between the University of Washington Center for One Health Research and Washington State University College of Veterinary Medicine. And then in collaboration with a federally qualified health center here in Seattle called NeighborCare Health. It's been very successful over time. We're seeing a lot of folks accessing human health care because they came to a clinic for their animals care. And the federally qualified health center reports increases in human health clientele, many of those who hadn't accessed care prior to visiting the One Health Clinic. We created a toolkit, which is a free toolkit online to help people in other communities replicate this model in their area. And we've been working with, we worked with New York City, and they have a One Health Clinic in New York City now, and Tucson also. And then there's a number of cities across the country and even like abroad who are working towards creating clinics in their area. If you're interested in a toolkit, again, it's free. We provide quarterly support, and actually anytime support, so we can help troubleshoot any issues that you're having. So this is all the information I already just told you. Oh, yes. So in addition to the collaborators at UW and WSU and Neighbor Care Health, this project was done at New Horizons Ministries, which is a co-sheltering youth and young adult enhanced shelter in Seattle. And we work also in collaboration with a student group called University District Street Medicine, or UDSM, who help, as Grace mentioned before, navigate clients and their pets through the clinic. Jessie's aim in her research project was to answer the question if integrated healthcare delivery with a One Health model enhances access to healthcare and housing to support improved health outcomes for persons experiencing homelessness and their animals. So she conducted semi-structured interviews with clients as well as healthcare providers at the One Health Clinic, and did a thematic inductive analysis looking at the responses that she got. It was a very, very small study, but because it is the first evaluation of its kind for the first type of integrated healthcare clinic of its time, it was important that we get the information out into the community. So there were 6 client participants, 2 veterinary healthcare providers, and 1 human healthcare provider participants. Of the clients that were accessing resources, 4 were in the young adult age bracket, that in Washington State is 18 to the 26th birthday. All of the clients had actually accessed housing within the last year through the various housing mechanisms, but also through New Horizons and their support team. And then there were 2 former clients who had aged out of the young adult program that also participated in the study. And if you look at the demographics here, it very much reflects the youth and young adult population that we serve at the One Health Clinic, as many of the folks are in the LGBTQIA2 spirit category and of varied ethnic backgrounds. Within the thematic analysis of the interviews, Jessie highlighted some of the important themes, included that human-animal bond, in which the clients were indicating that it helped them emotionally in times of stress, anxiety, depression. It supported them maintaining sobriety because they were aware that they had to be fully engaged in order to be able to care for their animal, and that the animal is clearly part of the family. And the providers, when thinking about the human-animal bond, they really understood that if they could engage with the pet owner through the animal, it helped increase rapport between the human health and the human health practitioner and the pet owner, that they could really build other resources and health activities on. When she talked to folks about barriers and enablers to healthcare, the enablers were proximity to services. It was pet-friendly environments. Having that veterinary care there really brought people into the healthcare building, and just having the continuity of care within that single location were big enablers for the clients who were responding to these interview questions. Barriers still included accessibility to transportation. Cost is a barrier to healthcare in general, not necessarily One Health Clinic, as that's a free service, but they indicated cost was a barrier to healthcare. Turnover and organizational change, aging out of existing resources, poor communication of other clinic times and hours, of other healthcare providers. Rigid clinical time hours is actually still an issue for the One Health Clinic as well, because we're only there every other week at certain hours, and that can be problematic for people to be able to access services. Perceived stigma by healthcare providers, previous trauma from accessing previous healthcare systems, and a lack of recognized safe spaces where these where clinics can occur. And again, just to clarify, this is just general healthcare access and not particular to a One Health clinic, but some of these factors are still relevant to our clinic and still are barriers that we constantly try to adjust and mitigate. General barriers and enablers to housing. We're at this conference, we're at a co-sheltering conference. Pet-friendly accommodations are a huge enabler to accessing housing and can be a huge barrier for people not able to access housing. And another enabler too is access and to steady employment. Barriers to housing is mental health, the mental health of individuals not being readily able to do all the activities needed to access and maintain housing. And again, the barriers, places that are not pet friendly. General barriers and enablers to community resources. Enablers include transportation, food programs, proximity, word of mouth, trusted contact. Trusted contacts as would be people like word of mouth of people who you trust, and then steady employment. And then again, still barriers are always transportation, rigid scheduling, unstable phone plans or access to phones, age, with the whole youth and young adult situation where you age out at the 26th birthday. Community resources not allowing pets in. So that's even outside of co-sheltering and housing. If you can't bring your pet into a case manager, or they can't bring it into a drop-in shelter where you were depending on that for laundry or for food or for other resources, that's also going to be a barrier. Yeah. Okay. And then finally, in looking at specifically at the One Health care model, we've really tried to decrease the barriers, and clients are reporting and providers are reporting a decreased barriers, which is the whole concept of the One Health Clinic, where if you have human healthcare and veterinary healthcare and case managers and housing support all within the same location, we can really improve healthcare access, improve housing access, because we also work with the owner and their pet to create emotional support animal letters, assessing both the owner and the animal, whether they're a good fit to be an ESA, but we do support that. And then making sure that the One Health Clinic is located in proximity to, adjacent to, and hopefully integrated with other community resources. Oops, my apologies. And so when we're talking about the One Health Clinic, One Health also includes the environment. So our providers, our human and veterinary healthcare providers, really can trace back to how environments are affecting the health of the owner as well as the pet. And so we consider the environmental risks and exposures that the owners and pets are going through and try to mitigate them throughout the One Health Clinic visit in order to try and address the environmental impacts and how people can be more resilient within the environment that they're living in. So in conclusion, clients and the providers indicated that the One Health care model has benefits, and enabling resource access is crucial. And we are also aware of the barriers that people still face accessing our services that we try to address and pivot to. Other similar integrations and services and locations can be used for overall population health and resource access. So bring in the social workers, bring in the veterinary social workers, bring in therapists and counselors and all the other type of service. They can fully be integrated into a One Health clinical care model. And integrating that human and animal health care could be preventative and capture holistic methodology, but it requires more rigorous study and resources. So that's why we're really trying to support other organizations starting clinics in their communities so that we can further look into how this is improving healthcare outcomes and how we can work even more collaboratively to support even more people. So here's a link to the toolkit again. And it kind of leads you through the full process of creating a clinic in your own community. And thank you so much for listening to our presentation today. If you want to contact Grace, her email is there. If you want to contact myself, and if you want to contact Jessie, the first author and data collector from the study that I just presented, all our emails are there. And we hope you have a great time at this conference. Thank you so much.